One common complaint most people have is of back pain, mid-back pain, and they keep going for physiotherapy, chiropractic, massage, which are all beneficial. The problem keeps coming back, and so they feel frustrated. Our approach is to look at the gait mechanism, which is how we walk. And what we found is that there are circuits, sensors if you will, in the cranium. Sensors in the shoulders and sensors in the pelvis. And these communicate with each other. Very much like if you would imagine a puppet has strings on its pelvis, on its shoulders, so that the marionette can guide how it's going to move. If these sensors are all communicating and calibrated or neurologically organized, the brain will sense wherever the horizon is. So even if you're walking up a ramp, you won't fall backwards. If you're standing level on the ground, you will just stand there. Because these sensors in the pelvis will relate from the ankles to the pelvis, pelvis to shoulders, shoulders to head, say where are we in space, and the brain will then decide and say, I'm going to send information back down to the musculature, and therefore I can hold a zero position. But when we start to walk, these circuits start activating, and we have one arm forward, one leg forward, and this is the gait position. And now if we take a trauma, if we take a clump to one side of the head, or if we fell while we're in our gait posture, we can get locked or neurologically disorganized into that file. And so now when the patient or the person comes back to thinking they're at zero, the child is standing there, really what's happening neurologically is their nervous system is holding in this pattern. Because this is the new zero. It hasn't been unlocked out of it. And now nobody notices that. And then the child, when he kicks a soccer ball, he looks a little uncoordinated, but we're not supposed to talk about that because the kid has to be perfect. When really, just bring him in and we can just fix that up right away, or at least we can try. And this child grows up now and always is leaning on one leg. They can never stand straight. And then their pelvis starts to fatigue on one side, muscles start to get shorter on one side, discs start to degenerate, which don't show up until their 40s or 50s. Then one day they lift something and say, I just lifted nothing or something small, and I ended up getting shooting pain down my leg, which is called sciatica. Then in their 50s, it's still not corrected. They go get repeat adjustments from chiropractors and physiotherapy, but every time they stand up, nobody's addressed the head in relationship to the pelvis. And so the pelvis is just following where it has to be based on what's coming from the head system. So we can connect those circuitries and very quickly eliminate that gait fault and start returning them back to true zero.